Welcome back to the Back Pain Solutions podcast. This is our first episode of 2025. It's me, Ben James, and as always, my co-host Jacob Steyn. Afternoon, Jacob. How are you?
I'm good, thank you, Benny.
Good. And today we're going to talk about a case study of a 25-year-old female patient. This is a mother, and so the challenges of looking after small children whilst looking after your lower back. So this patient is a symptomatic patient. They've been experiencing some back pain. They've been having some challenges with back pain for a little while. They've got young children. Clearly, lifting the children, doing daily activities is aggravating the problem. There's awareness of that. So we felt that it would be a useful case study to discuss because not just for a symptomatic female patient, mother, this is relevant for any parent, whether a mother or a father, whether you've got back pain or not, because whilst in this case they're symptomatic and we're trying to reduce pain and build up recovery, of course, this is a relevant subject in terms of risk for lower back injury. We see a lot of patients that have developed back pain after having children, and that might be increased risk with a female patient, with the mother having given birth, weak abs, a lack of attention of those abs, lack of follow-up. We've discussed this before on previous podcasts, but certainly when we're lifting children out of a car, in and out of the car, that can be a challenge. So we thought we'd discuss this patient specifically, but definitely there's broader application for other parents here that is relevant to listen into and to apply on a daily basis to help prevent as much as it is to help to treat and resolve a low back issue. So, Jacob, thoughts? Where do we start with this one? Because it's no doubt a challenge. You've seen patients to postpartum. I've seen them. We've seen fathers as well, and we've had to discuss children. And it's not something that people just really, I guess, like with a lot of things, give any real attention to or focus on when it comes to presenting with back pain. It's not something they would just necessarily assume could be a challenge here.
Yeah, I think Ben, like some things just overcome us. Uh, these are these are things we don't often prepare for, and it seems to be the case when we are young adults. We have children. We're also working. We've got a lot of things going on. We're preparing. I yourself as well. I experienced that as well not too long ago. Um, there could be a lot more in the way of preparing yourself, preparing your environment, as well as preparing your body physically. So it's extremely strenuous, and it doesn't stop for a long time taking care of a child.
Mm-hmm.
Whether it's getting up at night with feeding or changing nappies, or like you said, taking them out of the car, but also putting them in a cot, quite often quite low with a high wall. So the question really is, I think, and we could talk about this a lot. There's a lot to discuss, but we're going to keep it relatively short if we think of the main things. And I think it's really how maybe how can we prepare, as
Mm-hmm.
young parents in between the busyness of everything, and how can we best take care of our environment. Whether it's the sleeping situation, or I can also share things that we did for myself, especially for my wife, with breastfeeding, that she did, as it's something you do at night, and to make sure that we didn't break down,
Mm-hmm.
right? But we're going to discuss this case study of the young mother as well.
Yes, and in this case, the patient in question, if I'm right, didn't have leg pain. This is very much focused on the back pain. Not that it necessarily really matters in the context of general advice here. But did this patient have pain before children, or was it just after children?
Yeah, so I think no pain before, pain after. like we have in a lot of cases when we see mothers who gave birth, there's a big change in their bodies,
Yeah.
and it's really about, when I see a mother who's given birth, they've got a young kid, maybe not at that moment, but as soon as they get a chance, a few months along the line, we want to start cleaning up injuries that they've gotten, or accumulated stresses that happened during the giving birth or just after. So we want to get our body strong again,
Hmm.
right?
Yes.
I think that's a big focus, and I think quite often that doesn't happen. It gets kind of put on the side because they've got to take care of somebody,
Yeah.
they've got to get back to work. But I think really, if we can put some focus on getting them strong again, teaching them how to move properly, look at some spinal hygiene, whether exercises or things they can do to make sure that we keep the pressure down in the back, creating some healing capacity, increased tolerance, they can have a lot more joy with their body.
Mm. And not to mention as well the mental benefits, because
Yeah,
giving attention to yourself specifically here as a new mum, and looking after yourself and putting yourself first a little bit. There shouldn't be anything to feel selfish about in that regard. This is important because let's face it, the healthier and happier you are, the better you are to be able to look after the child. So this is also about putting some time in for you as well, specifically as a mother. And there's no doubt, when we're talking about this case specifically, and this still applies to people prior to pregnancy. It still applies to people to fathers prior to having children and post having children. There's no doubt one of the challenges, we've talked about this before, postpartum is the impact it has on the core muscles, because baby's growing, abs are stretching to accommodate, and then postpartum, whether via natural birth or cesarean, those muscles are clearly going to be weak, and that can affect the ability to brace and stabilize the back. So therefore, clearly there's a risk here of the onset of back pain postpartum.
yeah, yeah, and that's it really. It's the ability to create that intra-abdominal pressure. In other words, creating that pressure in the abdomen, in the front, that quite often goes lost after giving birth. And so we well, what happens to young mothers is they develop this strong communication between the brain and the low back muscles, because those are the only muscles really keeping them upright. As they lose the front of their core, and so when they've given birth afterwards, that program remains, and that needs to slowly get reset to using more abdominal function. In other words, like you mentioned, the bracing effect. And I want to mention, it doesn't mean that a mother after giving birth within the first few months have to learn how to brace with a lot of power. It's simply being able to use the diaphragm to create a little bit of pressure in the front,
Mm-hmm.
so the back muscles aren't doing everything, right?
Yes.
It's getting back to proper biomechanics in order to relieve pressure in the spine, especially when we're picking things up or moving things or twisting.
Yes.
Um, yeah,
Yeah. So I think that that'd be a relevant, great kind of action application point to just drill down on as a simple thing for people to take away from the podcast today. Because what we're not saying is you need to, baby's born and suddenly you're going back to the gym, 2 days later. What we're saying here is a little bit of time and attention to yourself, but that can be done in short bursts at home. And so, dare I say, there shouldn't be the excuse of a lack of time. And um, having been a young parent myself, that I understand those challenges. But let's just talk about a little bit of maybe a breathing exercise or a focus for people that they can maybe visualize when listening to this, from an activation of diaphragm and breathing, that can be even a day or two after birth, could be very easily done, that will help in terms of that reactivation, re-engagement of the core, even if that's slow, progressive, you know, a part of a slow progressive plan. What are the things that they could be considering here?
in the beginning, we want to stay away from creating too much pressure in the abdominal cavity. In other words, in your abdomen in the front. So the idea that we're going to brace with a lot of power is something that will become something we do much later. So
Yeah.
in the beginning, we want to see that someone's able to breathe in their belly. So we want to see proper diaphragmatic activation. And so what will happen quite often is we get higher breathing during pregnancy, and also after that, we get chest breathing, and we lose this ability to use the diaphragm to create a little bit of pressure in the abdomen. And simple diaphragmatic breathing, in other words, breathing in your belly, is already a first step in activating the diaphragm and will help you along the way. Later, we need a little bit more activation. And we may need some lateral abdominal wall. So we're thinking side planking, things like this to activate and complete the whole, the complete function of the abdominal cavity. But in the beginning, it would mainly be maybe lying on your back, breathing in your belly. You can use fingers to squeeze yourself on the side and feel what happens with your tummy,
Hmm.
whether there's a little bit of an increase of pressure. Very gentle, very light, once a day, at least once a day, few minutes, not more.
Yeah. So we're focusing on that breath kind of coming right down into the abdomen and allowing that abdomen to expand a little bit versus this upper chest short, shallow breathing almost.
Yeah,
Okay.
exactly.
So that's something that, when you get that brief moment when the baby, when, let's say you've just got a newborn, baby's asleep, you've got that little bit of time, if you're not having a nap, a sleep yourself, lying on your back, taking some time to relax, just focus and think about that breathing a little bit, just to start to get that re-engagement and connection with those muscles, brain muscle connection, just so that we're starting to be aware of that area, because we definitely want to focus on reconditioning that anterior abdominal wall. As Jacob says, the lower back muscles take so much of the toll as pregnancy progresses that those abdominal muscles, the anterior abdominal wall, really starts to get weak. So we want to look at reactivation there. And Jacob, in terms of other things, particularly key things, because exercise and addition of exercises and core strength, core endurance, we definitely want to consider that, and there's definitely things that could be done pretty early on. But I think what's probably more helpful and maybe more relevant with this case in mind is more the awareness of back position when doing those simple daily activities. We talk about this a lot, the fundamental movement patterns, the daily spine hygiene, and the exercise. Those key areas are still clearly relevant here, but there's a few differences to consider with respect to, or not necessarily differences to consider, but maybe to overemphasize in this case when it comes to carrying a baby, lifting a baby out of the cot, etc. That will cumulatively impact a low back, whether you're suffering now or whether there's a risk of suffering if you're not aware of this. Um, any thoughts on that? Clearly the neutral spine and the bracing, I guess, are key elements here as always. Um, but in terms of the challenges with this patient in mind, was there anything that you identified and discussed that was a provocative, that was something that was clearly an aggravating factor, particularly?
I think, especially for young mothers, when they whether bottle feeding or breastfeeding, it's they spend a lot of time lying or sitting. As I remember in our case, in the beginning it was mostly sitting, and later on, as the baby is able to drink lying instead of being a little bit more upright, then the mother can also lie down, and that's really relaxed for the back or the neck or the shoulder of a mother. But so I think there's a lot of time being sedentary for a very good reason, and I think you need to choose your chair or
Mm.
your the way in which you recline. You have to choose that carefully for your body type, with your short to long, or whatever you feel is good, but you need to make sure that it's not going to be something where you slouch,
Yes.
right? So you don't want to slouch to your low back in a chair that doesn't give any support to your low back, or a chair that's ending up, you should prop yourself up, put something in your neck so you can relax your head, because quite often you see that these mothers they develop problems in their neck, so they've got to hold their neck still or a certain position when they breastfeed or bottle feed. So make sure that you find a good chair, right? Or if you're going to do it on the bed, make sure that the pillows that you stack up is really taking care of your body, something that you do numerous times a day and regularly.
Yes. And this is something that if you're not suffering from back pain, is something that you might disregard, and in some for obvious reasons, because let's face it, there's a big sleep deprivation that we all have to face, unfortunately, with having young children, babies. But if you are suffering, but even if you're not, really give consideration for that, because if you are being woken multiple times, which inevitably you will be in the first few weeks at least, and you're having to feed, which inevitably will be the case, then it is very easy to just say, right, I'm going to sit in bed and I'm going to breastfeed there. Now, of course, when you're sat in a bed up against the headrest, your legs generally are going to be straight out in front of you. That is always going to be a challenging position for a low back, which we talk about this a lot with sitting on a sofa or a couch for anybody suffering
Mm.
from back pain. These are challenging chairs and furniture to sit on, because inevitably your legs are straight, and unless you've got fantastic flexibility in your hamstrings, you're often drawn into a more flexed, stooped, slouched posture. That can put a lot of pressure on lower backs in terms of disc structures. That can be a huge problem for lower back pain, whether that's creating it or keeping you in an aggravated, unhappy position. So
Yeah.
whilst it is difficult, you've got to be really mindful of trying to be more upright and neutral in your back when you are doing those in those feeding scenarios. And clearly, when you're tired, sometimes you just want to get that baby fed and get back to sleep. But cumulatively, this can have an impact. So it might be to the feel like it's more of a challenge and harder in the early stages, but you will reap the benefit further down the line if you can just be a little bit more mindful of that. And if that involves, in some instances, sitting at the edge of the bed, so maybe you don't have the back support, but you're at least not trying to just sit upright against the headrest of your bed and keep your legs straight, then that might just be the lesser of two evils than sitting in a specific chair, shall we say. But it's certainly something to be mindful of, because as always, a lot of the time
Yeah.
it's cumulative impact on a back, on a structure in the low back, that causes these issues or keeps you sensitized, keeps you irritated. So we have to be mindful of that, and that comes into the category of daily spine hygiene. So you might be sitting in an office chair every day, or you might be sitting trying to feed your child regularly every day. Either way, we've got to be mindful of that posture.
And I want to say, Ben, I mean, you have to recognize when you're treading on ice. So if we're in a situation that's already very vulnerable, one of your goals is to stay away from the tipping point,
Yes.
right? So we're in a vulnerable situation where we've got lower tolerance. We're exposed to numerous factors every day that's going to play with that level of tolerance. And if we go beyond that zero, we go over that tipping point, that's when we get into trouble. We want to stay away from that.
Yeah.
And that's what people often don't realize. They're like, oh, well, I didn't do anything, I've done the same thing. But it's the same thing cumulatively that ended up us going over that tipping point, and then the body reacted.
Yes.
And what we then have is a young mother who's you know um, faced with a lot of challenges and having pain, and there's no way out because you got to keep doing what you're doing. And we want to avoid that, right? And
Yes.
it becomes much more difficult to turn that back, to get them back on track where they don't have pain because of all these obstacles they have every day.
Yes.
And
Yes.
so, and that's also a big reason why we have this podcast. So we can get people to go, okay, heads up, you need to pay attention. When you're in the situation, let's take make a couple of changes that's going to make sure that we keep the tolerance higher than we'd like in a normal situation where we're exposed to all these things, and so we have better ability to cope with it.
Yes. Yeah, and I think that would be a key kind of take home at the end of this episode, is that in that specific scenario of this individual here, and for those that can relate, a lot of the 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 capacity is taken up with being a new mother potentially, or it's a second child maybe, and you've got all that to deal with. Let's try and at least remove those aggravating factors and keep good daily spine hygiene. Don't worry so much about all the exercises and the other things that can come to build abdominal endurance and conditioning, etc., which will all be helpful. But let's focus on those simple things that can have a cumulative benefit, a significant
Yeah.
cumulative benefit, by just repeated daily and just by being a little bit more mindful of it. And I would add to that the lifting when it comes to putting a baby in and out of a car seat, for example, because a lot of people now will have these car seats that we can remove from the car, which is great, but then that car seat's being put on a floor in the house, and then you're trying to get the baby down to put them in that seat. Clearly, if you're trying to get down to that seat to put the baby in the car seat to then take it out, you can often be bending through the low back, and that's a decent weight, bending through the low back, that you're going to be doing potentially quite a few times on a daily basis. So we've got to start to try and be a little bit more mindful of that movement. And so in the same way that we're trying to reduce that flexion by poor sitting, let's also try and be mindful of keeping that baby close to us, lunging down to the floor so that you're keeping back in a straighter position, to then get a baby in the chair and then lifting off the ground. And similarly, when we're trying to get that car seat into the car, being a little bit mindful of creating that little bit of tension through the abs, and trying at least not to bend through the low back so much, trying to remain upright as much as possible, so that again, cumulatively, these little things are not compromising back health and not leading to kind of continued sensitization, irritation that can either keep a back irritated or lead to a back problem. Because we certainly don't want to be experiencing a first incidence of low back pain following that birth, because that then again leads to a poor experience, which we just don't want. So we've got to be more mindful of the cumulative effects of poor movement on a daily basis. And also that's the same in the first few days, few weeks. No doubt they're probably not going to be in a cot, so getting them in and out of a cot is less of a challenge in the short term. But again, definitely this is something, Jacob, in my experience, that I've seen quite a lot. That is often a provocative or potentially provocative activity, because
Absolutely. Yeah.
unless that the side of that cot is almost below the level of the hip, it's hard to pivot over the hips to get the baby in and out of the cot. Have you faced this? Have you had any
Yeah.
I guess solutions for this? And then I
Yeah.
can tell
I
you
was
what
just
I do.
thinking about the cot, Ben, because it's such a big deal. So what we did was, I got the cot from IKEA, and it had two settings for the height of the actual mattress.
Okay, yeah, yeah,
So
yeah,
so you could have it really low for when they're bigger and they stand up and it's safe, they can't climb out
yeah,
or fall out, and you've got the higher level for when they're younger and they only lie, they can't stand up. So what I did was I drilled extra holes before I put it together, so we had more options.
yeah.
So
Okay,
in the very beginning, I put it even higher, so a few inches higher, so it'd be even less of a bend forward for my wife to pick them up.
yes,
And then as they got a little bit bigger, I gradually worked the thing down until I had to have it low.
yeah,
And so in that way, we avoided unnecessarily having to go, to pick them up from so low.
Yeah.
from that low if it wasn't necessary.
And reaching the arms in as well. So you've got that challenge of trying to get them out from a low down position and with your arms out, which creates a huge amount of potential pressure and load through the
Absolutely.
low back. So I've had in instances conversations with patients where I've had them use a step almost, and as always we want. I'm not talking about a little step that there's a risk of falling off, because that creates other challenges. But having enough of a step or platform that has just raised the height of the individual, so that when they are that little bit bigger and the cot, as in the mattress, is lower, now we can get it over the cot quite effectively. So your body's almost very effectively over a good amount of the cot. So you can quite easily lift and pivot through the hips. Now that still requires a good amount of core strength and awareness of bracing those shoulders down, locking those shoulders down, chest muscles switched on, lats in the upper back switched on, so that we're really creating that stiffness throughout the back. But it doesn't mean that I will have to bend through the low back, because as soon as that top of the side of the cot is above the level of the hips, then if you're trying to reach in, you're having to bend
Yeah.
through the low back. So we've got to be mindful of trying to get that height up. Now, also, when children get that little bit older, and depending on the age of the child, when they're in and out or out of a cot, they'll reach a certain age when they can kind of understand that when you go to lift them, they'll give a little jump. So when my daughter loved her cot, she was very comfortable in it. So when she got to a certain age, she'd stand up in the morning, I'd go in, and I could communicate with her to jump up to daddy. And as she jumped, that momentum would allow me to pick her out without bending and compromising my back as much, putting as much pressure through my low back. So these are just little things to consider and be mindful of. But the key aim here is, don't repetitively be bending through that lower back. And as always, we're not being fearful of that movement for certain scenarios, but it's the repetition of that movement. And particularly when we're putting a decent amount of load through the back, as in lifting a child, and they do get heavy, we've got to be mindful of how we adapt so that we can reduce that compromise and reduce that risk.
It's a good one, and it almost sounds counterintuitive to place a step in front of the cot, which makes you taller and higher,
Yes.
and then reaching down. But it makes so much sense, because if your pelvis is lower than the edge of the cot, you're going to have to round your back in order to get over the cot.
Exactly.
Whereas if you're a bit higher, you're maybe even more likely to bend your knees a little bit, which is going to give you more benefit of picking something up. Like, as we know, if you pick something up from the floor, you bend your knees a little bit and bending through your hips. But that's much more comfortable, and you've got much more of an advantage picking up something heavier than just having your knees straight.
Yes.
Um,
Yes.
so yeah, I like that. No, we didn't do that. That's a very good one, Ben.
Yeah, and of course there are some cots as well that the side can drop down, right? And perfect. So now we can
Yeah,
drop the side down, and we don't have any of those challenges. But and you don't need to necessarily have to bend over at all. But there aren't that many around versus fixed ones, if you like. So
I agree.
it is
Yeah,
definitely something that, as you know, as things develop and the baby does transition into the cot, you've got to be mindful of. And the same with the bath, because a bath is another one. One of the things that you could consider, of course, is bathing in the bath a little bit with the child if you really needed to reduce that compromise. But otherwise, you still have that same challenge of bending over the bath. So you've got to try and not arch that back over the bath, because unless they're in the bath for a very, very brief moment, that's going to involve arching that back and holding and fixating that position for a period while you're trying to bathe the child. So if you're gonna
yeah,
be bathing a baby, then of course you can use a separate bath that's a standalone, much smaller item, of course, which means that now you could kneel on the floor and very easily do that work. But as soon as they start to get into the bath, we've got to have that same challenge as we just discussed with the cot, that bending and arching over the bath consistently, repetitively will be a problem. So you've got to try and stand up, keep the back straight, and pivot over that hip to do that work, and then come back out, kneel down, and then you could talk to your child and let them play in the water, play with their toys without compromising your back. But if you're cleaning them and doing that piece of work, then again, you've got to be trying to employ the movement of your hips and the strength and stability of the hips versus compromising the low back. Because again, cumulatively, that will have an impact. And we've just got to address that. We've got to be mindful of that. And so, Jacob, in this case, in point, no doubt you discussed these kind of things. How was the response of this patient? Was it a pretty easy solution? Was it pretty protracted in their rehabilitation? What was the outcome, and where are things at the moment?
Not easy, but gradually better, because we're managing a situation, as I mentioned, that has many obstacles. There's um, there's being back at work, waking up at night, first child, so we tend to do more than what is necessary.
Yeah,
Also has a bigger effect on us. We're more affected by things, making
yeah,
sure, hoping and being assured that everything's okay with your first child is definitely taking a bigger toll than your second one.
yeah.
And yeah, so definitely much better. We've got the strategies in place to make sure that she's lowering pressure in her back, doing certain things that previously was really a disaster.
Mm-hmm.
And so she can at least see the light, knows that it's temporary. She's able to manage. Um, she still has a little bit of pain, but really under control. And that will definitely resolve, in my experience, once she gets given more of an opportunity, and as the child gets a little bit bigger, and she recovers even further.
Yeah.
Yeah,
But I'm guessing that no doubt when she first came to see you, some of these simple things that she could do and she needed to do, as everybody does that's had a low back issue, she wasn't necessarily aware of them. I guess it was very much, what can you do for me, versus
absolutely,
yeah,
absolutely. It was more like the typical approach, typical, but quite often the approach of a patient is, how can you make me better? But what she realized is that it's within her own hands, and it's what she does 24 hours of the day has a lot more impact than what I might do in a very short space of a treatment.
yes, yeah,
But she's very grateful for that, because she's now empowered. She's got the
exactly.
strategy. She knows it works. And yeah,
And I think that's a great place to finish. Ultimately, this is about empowering people to look after their own back health. Because once you know what you need to know to reduce daily irritation, stop picking the scab, improve daily spine hygiene, and start building good, effective core endurance, then you'll feel like you could manage your own back health and you could do whatever it is that you want to do. Because let's face it, patients that come to us ultimately aren't just trying to get out of pain; they're wanting to get back to doing something that they love, and that's ultimately what we're all about. So I think the take home here is, for any new parents out there where you're suffering low back pain, there are simple things you can do that don't take an enormous amount of efforts in those early stages. Breathing is a good one. Just starting to tap back into good deep breathing, abdominal breathing. Start to get a bit of an awareness about those abdominal muscles so that you start to use them again. Start to get them reactivated, but be really mindful of daily repetitive movements that could compromise your low back. And most often that is going to be bending through the back, bending and twisting repetitively, that just keeps irritating a low back issue, or is often the cause of an issue. So if you can just manage those few things, like it, baby in and out of a car, in and out of a car seat, bath, etc., then you will definitely help your low back health. But as always, if you've got any specific questions, reach out, info@smartstrong.co.uk. We'd be happy to help. We've got a program, of course, that takes you through all the stages to rehabilitate a back if you're suffering, if you're facing low back challenges and low back pain. That's what we're here to help with, empowering you to get back to the activities you love. So Jacob, thanks very much. And thanks everyone for listening. We'll be back again soon for another episode.